Hi everyone, welcome back to my channel. My name is Tamika and I go by she and her pronouns. Today's video, I want to talk to you about how to ask for what you want and need within navigating the healthcare system, especially if you're someone like myself that lives with, I apologize, getting my papers, that lives with chronic pain. How do you navigate that? And how do you ask for help? For myself, it's been about a good 7 to 8 months of asking for help for the chronic pain and not being taken seriously. And when I say asking, I have never missed an opportunity to share that, whether it's been with my family physician, with any of the specialists that are part of my care team. And yet I've been told there's wait list, maybe your case is not that severe, or try extra strength Tylenol, for example, like very band aid, very surface recommendations. And it has been exhausting trying to get the care that I actually need to address my issue because I don't know what's causing this pain. I don't have a diagnosis, and I don't have a specialist that's just focused on this type of pain that I'm suffering with. So I've had to keep pushing forward. And when I mean pushing forward, I've been the one who's done the Google searches to find out who are some of the best specialists that deal with this kind of chronic pain. Where are they located? What kind of clinics do they work out of? Are they accepting new patients? Is the type of pain that I'm describing within their scope of practice? This is what I've had to do and bring this back to my care team, bring this back to my family physician, and hope that I can get a referral to one of these specialist teams. And it has been, let's just say, a battle. Oftentimes, they say they're taking new patients, but they really are not. They might be taking patients, and you are somehow outside of their scope of practice, so you're just not quite the patient that they're looking for. I didn't know that in Ontario, doctors get to choose the specific types of patients they get to treat. That's quite nice. I wish when I was working and I wasn't on medical leave, I got to choose the types of people that I got to provide service to. That would have made my life so much more easier. So, but in any case, the doctors have the choice to refuse your referral, and I have that happen to me quite consistently. So, despite suffering and being in agony, and trying to explain that to anyone with ears in the healthcare system that I encounter, I was still getting rejected. And don't be surprised if it takes you that length of time, if not double. I know people who it's taken up to 2 years to get a specialist, get a diagnosis, and get onto a treatment plan and start getting medication and care that is actually appropriate for their needs. So this is the healthcare system that we're in. Here in Ontario, we're in election cycle for municipal, for the local politicians. They're not the one who set the healthcare budgets. But the thing that they need to realize is that their constituents are suffering. There's a lot of suffering that's happening out there, and a lot of people just stay silent. They don't ask for help. They don't get the care, or the care that they get is in the ER, which again, that is another one-step gap. Going to the ER to get care, especially if you're suffering with a chronic anything, it's not going to be sustainable. You're not going to be staying in the ER indefinitely. So we have a lot of pain and a lot of suffering that is happening out there, and oftentimes we're not being listened to on a consistent basis. So many people just keep it inside. I was one of those people for many, many, many years. I thought that it was a sign of strength to fight through the pain, to live with the pain. So how have I learned to basically ask for what I want and need? I've come to the edge. I've come to a breaking point. So number one, that has helped. I feel I have nothing left to lose. I have had to fight, literally I had to fight for my life. My illness was that serious. I've had to keep asking like a broken record over and over and over, and that has been extremely frustrating and extremely mentally exhausting. I've had to seek case management supports where they are available. So if you are able to access any kind of case management supports from different organizations that are in community, I would encourage you to do so. I've gone to the point where now I can't really be the one speaking directly to a lot of these care providers because my patients, I lose it very quickly because it's been so long. I've been so frustrated. So I'm not the one to be able to speak oftentimes in a calm, rational manner, especially if I feel like I'm getting the runaround once again. I find it helpful to write things down. I write them down so that when I go to these appointments, I have kind of like a guide. So that way I'm getting the care that I need for what my symptoms are, not just something generic that the doctor might be suggesting, recommending based on their training and not knowing the ins and outs of what I'm experiencing in my body. So that has been a big help. The other thing, of course, the internet can be both a blessing and a curse. You can get into a rabbit hole and start diagnosing yourself with all kinds of things. Or you can also get some really good information in terms of the doctors. There's Rate My MD, for example. You can go on the professional website to see have they been sanctioned? Have this doctor been disciplined? Is this doctor under supervision because of an infraction that they caused or that they did? And so the college is now having them under supervision with a more experienced physician. Like, you can find that out. And if that helps you in terms of your journey, I would totally encourage you to do it, because I find for me the knowledge has been empowering. For some people, they just don't want to know. I want to know if the doctor that I'm interacting with is someone that is actually good at their job and is not constantly getting back and forth complaints with their colleagues, that's being called up by the college, that the college has to have a supervisionary eye on them for doing something that they should not have done to begin with. So I do want to know those things, and it helps me to feel better. It also helps me to ask a lot more questions too when I need to, because when I come in there prepared, I find that the visit goes a lot differently. So don't be afraid to go into those visits prepared with your questions. And also don't be afraid to realize that you might get pushback from the physicians, because I don't think they're always welcoming to answer questions. It really depends on the personality, so I don't want to generalize. But I know that as women, as Black women, we're very likely to be dismissed. And that's one of the reasons why it's important that you write things down, that you have a diary, that you have a journal of what's happening, that you keep even a pain management log in cases where necessary, because you really need to make it known that you're not going to just push me aside. I'm not just a number. I might not be important to you, but I am important to the people in my life who love me. So I just wanted to share that with you all today. I've been successful in getting some referrals. I haven't attended the appointments as of yet. So once that happens, I'll happy to share to, obviously within reason, the outcome. But I just want to say today, if you haven't heard it already, to cherish Black women. Black women deserve to be loved. Black women are lovable, and our stories deserve to be told, and we need to lift up and amplify our voices. Thank you for listening, everyone. Take care and have a blessed day. Bye.